Patella. Patella in Latin means a small plate. It is the largest sesamoid bone in the body, developed in the tendon of the quadriceps femoris muscle. It is situated about 1 centimeter above the knee joint in front of the lower end of the femur. Side determination of the patella. Anteriorly, we have the apex and the base. Posteriorly, we have the medial facet and the lateral facet. The patella is triangular in shape. The apex is directed downwards. The apex is non-articular posteriorly. The anterior surface is rough and monoarticular. The upper 3/4 of the posterior surface are smooth and articular. The posterior articular surface is divided by a vertical ridge into large lateral and smaller medial areas. The bone laid on a table rests on the broad lateral area and determines the side of the bone. Features of the patella. The patella has an apex which is directed downwards. It is rough and vertically ridged. It is covered by expansion from the tendon of the rectus femoris and separated from the skin by the prepatella bursa. The posterior surface is articular in its upper 3/4 and monoarticular in the lower 1/4. The articular area is divided by a vertical ridge into large lateral and small medial portion. Another vertical ridge separates a medial strip from the medial portion. The strip articulates with a reciprocal strip on the medial side of the intercondylar notch of the femur during full flexion. The rest of the medial portion and the lateral portion of the articular surface are divided by two transverse lines into 3 pairs of facets. This is the superior, inferior, medial and the lateral portion of the patella. During different phases of knee movement, different portions of patella articulate with the femur. The lower pair, which is 1, articulates during extension. The middle pair, that is 2, articulates during beginning of flexion. The upper pair, which is 3, articulates during mid-flexion. And the medial strip, which is 4, articulates during full flexion of the knee. Attachments of the patella. The superior border or the base of the patella provides insertion to the vastus intermedius, the rectus femoris. The medial border provides insertion to the vastus medialis, whereas the lateral border provides insertion to vastus lateralis. The non-articular area on the posterior surface provides attachment to ligamentum patellae below and infrapatellar pad above. Ossification of the patella. The patella ossifies from several centers which appear during 3 to 6 years of age. Fusion is complete at puberty. Half centers at the superolateral angle of the patella may form separate pieces of bone. Such a patella is known as bipartite or tripartite patella. So these are diagrams of bipartite patella. Clinical anatomy of the patella. Fracture of a patella should be differentiated from a bipartite or a tripartite patella. The patella has a natural tendency to dislocate outwards because of the outward angulation between the long axis of the thigh and the leg. This is prevented by bony factor, that is, the lateral edge of the patella, articular surface of the femur, is deeper than the medial edge, and also due to muscular factor, that is, insertion of the vastus medialis on the medial border of patella extends lower than that of the vastus lateralis on the lateral border. The vastus medialis is the first muscle to degenerate and the last to recover in knee joint disease. Bursitis occurs in prepatella and subcutaneous infrapatellar bursa. Quadriceps femoris is inserted into patella from where ligamentum patella arises, which ends into the tibial tuberosity. The medial and lateral patella reticula are extensions of vastus medialis and vastus lateralis. These strengthen the capsule. During sudden severe contraction of quadriceps, the tibial tuberosity may get avulsed. The tibial tuberosity ossifies as a downward protrusion of the upper end.